Ladies and gentlemen, welcome once again to another episode of the Think Clinical podcast. My name is Hamza. Today we're going to talk about reimbursements. We're going to talk about reimbursement rates. We're going to talk about pricing strategy. We're going to talk about all the challenges that you've been having just running your clinic and trying to work within the framework of what you bring in versus what you actually spend. This is very important because the landscape of healthcare is changing so much. And according to research in 2024 by the Medical Group Management Association, 43% of private healthcare practices operate with profit margins less than 5%. Now, this is lower than the average grocery shop. Why? Because most practices price their services based on what insurance would pay and not what the service is actually worth. So today we're going to be talking and we're going to be going deeper into some of these, because whether you know it or not, the average insurance reimbursement for healthcare services covers roughly 70 to 80% of the actual cost of delivery when you factor in overhead, when you factor in staff time, when you factor in provider expertise. Which means if insurance is your primary pricing anchor, you are building a business designed to fail already. Okay, so today, how do we talk through fixing that? Now, before we do that, let's talk about the insurance trap and why insurance-based practices are killing most of the most practices. And I always like to start this with the math because the numbers don't lie, right? Let's assume you're a physical therapist. Insurance will reimburse you $75 for a standard evaluation. It sounds reasonable, but when you actually break this down, your 60-minute time at $100 an hour for provider rate, it means you're already upside down, right? Now you have support staff who would probably dedicate about 20 minutes of their time at $25, so that's about $8.33 thereabout. And you have your overhead. For that period of time, you have your rent, you have your utilities, you have your insurance supplies, which is 40% of your revenue, right? So it's going to be what, 30%. And then you have your total cost of delivery, which now comes up to about $138, almost $140. So you are losing $63.33 per insurance reimbursed patients. So your only path to profitability in this practice is volume. Because if you don't see more patients within that hour, within that same hour, if you are unable to find a way to move between patient appointments and be able to see more patients within that hour, you are not going to be able to cover your overhead costs, your staff time, as well as the rate for the provider. And a Harvard Business study on healthcare economics found that practices primarily reliant on insurance reimbursement had 52% higher provider burnout rates because they have to see a lot of patients to be able to stay up. 38% lower patient satisfaction scores because you don't spend that much time with patients, so they are not happy with you. And 2.4 times higher staff turnover. Why? Because the model forces you to compromise quality of care to hit volume targets. Otherwise, you have no business tomorrow and you have to close down. When insurance companies set prices, they control your business, so they can cut reimbursement rate by 15% with 90-day notice, and there's nothing you can do about it, right? So according to American Medical Association, average insurance reimbursement rates have increased 10.6% over the last 15 years. 15 years. You know what practice overhead costs have increased? 47%. Whilst reimbursements have increased only 10.6%, overhead costs has gone up by 47%. So you are in a slowly tightening vice, right? So it brings down this conversation to value-based pricing and fundamentals, because value-based pricing means charging based on the outcome you deliver, not the time you spend or the procedure you perform. But here's the principle: patients don't buy appointments, patients buy results. So when you look at the equation for value-based care, we are basically saying that the patient's perceived value of outcome, if we take out the cost of alternatives and multiply by the probability of success, that is what we are talking about in terms of value-based care. So let's make this more concrete. In traditional insurance pricing, for let's say a chiropractic practice, the per visit rate is what, $65, right? That's what insurance will be reimbursed. Typical treatment is 12 visits, so that's $780. So value-based pricing would say, what's the value of resolving chronic back pain that's prevented someone from playing with their kids, sleeping well, and working productively for 2 years? That's what value-based care would assess from this. And what is the alternative cost? Is it the ongoing pain where you buy medication for about, let's say, $100 a month, possibly surgery, which will cost you $15,000 plus, or continued loss of productivity, which you can even calculate, you can quantify that. When you have these, the probability of success with your treatment of 85%, and you put it together, the treatment isn't worth $7,800. It's probably worth between $5,000 to $10,000 in avoided costs and restored life, right? So when you look at this pricing from this survey from Stanford, that found that when healthcare providers frame pricing around outcome value rather than time or procedure, patient satisfaction actually increased, even when prices were 40 to 60% higher. Why? Because patients felt they were investing in an outcome and not purchasing a commodity. And I have had other episodes where I've talked about how you help patients cross some of these barriers that prevent them from getting the help or the treatment they need. Now, when we look at this, it means that we are saying that there is an option of a cash pay model. And that's important at this point because we all agree at this point, and with the math I just presented, that there's no way the insurance reimbursements will cover the whole cost of what you spend on the patient at the visit. So according to 2023 Healthcare Financial Management study, 44% of patients under 45 prefer cash pay options with transparent pricing over insurance confusion. Cash pay pricing have 23% higher profit margins than insurance-based pricing. Patient satisfaction scores are 18% higher for cash pay practices. So you can always look at cash pay as an option, but you can look at this in three models. One, you can do pure cash pay, where you are basically saying that you don't accept insurance at all. Patients pay out of pocket, and you provide a super bill they can submit for potential reimbursement from the insurance. This is best for high value services where insurance reimbursement is particularly low, like functional medicine, concierge primary care, certain dental procedures, cosmetic dermatology. Now the pricing freedom here is that if you have, let's say, a dermatology clinic who go from an insurance base to cash pay, it's clear that their previous insurance reimbursements for, let's say, an acne treatment is like $150 per visit. The new cash pay program is priced at $299 a month membership with unlimited visits, right? So this is what it means. The result is that revenue would increase by about 67% and patient outcomes be improved because more frequent visits, they can come to you at any time they want, and provider satisfaction skyrockets. So the first one is just pure cash. Second model is a hybrid. You accept insurance but also offer cash pay options for patients who want faster access, longer appointment times, or services insurance doesn't cover. And this is best for practices in transition, serving diverse patient populations. So you may be in a community where you have the whole 9 yards, so you are offering everything. And the structure is that standard insurance based appointments are between 15 to 30 minutes, and the cash pay premium option is 60-minute appointments at $250 to $400. This is how most people do. The third level of this is the membership or subscription model, where people pay a monthly or an annual fee for defined services. So for instance, primary care, dentistry, mental health, physical therapy, right? And the math here is that the primary care practice charges about $150 a month for membership, includes unlimited office visits, telehealth, basic lab work, care coordination. Average patient sees you 4 to 6 times per year, so your actual cost per patient is $60. Total annual cost for the patient is $1,800. So you do understand how this is going to look like. So total annual value received is about $1,500 to $2,000 in insurance, for insurance world pricing, right? But there's here's the key. With predictable monthly revenue, you can afford to spend real time with patients And appointments are usually 30 to 45 minutes instead of 15-minute appointments. And patient outcomes improve dramatically as well as their satisfaction scores. Now, this is where the negotiation game comes in, because if you are tied into the insurance game, how do you get yourself at least in a comfortable place? If you are going to accept insurance, you need to really understand that reimbursement rates are negotiable. You need to understand that. Most providers don't know this. They sign whatever contract the insurance company puts in front of them, and that's leaving massive amounts of money on the table. What's your first leverage point? You have something they want. You are the only specialist who does a specific thing in that geographic area, so you have to go back and negotiate with them. That's one. Two, you have the volume, because everybody has dropped that insurance, so they do realize that nobody else wants to work with them, so they work with you. So for the negotiation framework, usually is that you first of all have to do the math, calculate your actual cost to deliver each major service category, and know your break-even point. That's the first thing. The second thing is that you do your market research, and you use the Fair Health Consumer or Medicare Physician Fee Schedule as a baseline for comparison. And if you are being reimbursed 25% below market average, that's your opening argument. Thirdly, you build your case. You document your value, patient outcome data, satisfaction scores, unique expertise or equipment, volume you bring to their network, and then you make your ask. So based on your outcomes data, volume, and market analysis, we are requesting for reimbursement rates that are in the 75th percentile, for instance, and then be willing to work, because that's the most difficult part of it. If the insurance contract is costing you money, you have to be willing to drop it and move to other options. And the pricing psychology is that how you present the pricing matters as much as the price itself. So the first principle is what we call the decoy effect. When you offer 3 pricing tiers, most people choose the middle option. This is how, especially for people who are looking to do cash payments, that is how you present it to patients. The second principle is annual versus monthly framing. When you go to someone and say, hey, your subscription or membership would cost you $1,800 a year, they see it differently from saying, oh, it will cost you $150 a month, right? So the way you frame your costing is important. And the third principle is comparison anchoring. Instead of just saying your price, compare it to something familiar. You can say something like, the investment is $4,500, which is about the same as the monthly payment on a mid-range car, but this will last you 15 to 20 years and dramatically improve your quality of life every single day. Okay. The fourth principle when you are talking about pricing is transparent breakdown. Patients must, and they will, and they're required to see what is going into the pricing. So this is the breakdown for instance, the $3,200 charge for this procedure. You are going to surgical procedure is $1,800. Your follow-up visits will cost you $600. Lab work will cost you $400. 5 years warranty on ongoing care. You have to break it down for the patient to understand. And then it moves on to the implementation framework. It's always a 30-day action plan. The first week is always to analyze, calculate your true cost of service delivery for your top 10 services, compare to your current reimbursement rates, and identify your biggest loss leaders. Then in week 2, you survey 5 to 10 competitor pricing. Call as a mystery shopper. Review Medicare fee schedules for your services. Identify gaps between your rates and the market rates. And then in week 3, you design. You create a cash pay pricing structure for your top services. You design a membership or subscription option if relevant, and build out a 2-tier pricing model. Then week 4, you test it. You offer cash pay options to new patients only, track conversion rates, and adjust based on the data. This is how you can get this out there and be able to position yourself strategically. Ladies and gentlemen, pricing is strategy. It determines who your patients are, what kind of care you can provide, and whether your business survives. If you are pricing based solely on what insurance will pay, you are not running a business, you are running a charity for insurance companies. For the cost of service calculator, the insurance contract negotiation template, and the membership model designer, check the show notes. And we will continue to provide you with all the information that you need, and as you build your framework around these principles that we share with you each week. Thank you so much for your time. We appreciate you. Remember to subscribe, like, and share, and we'll see you in our next episode.